Right, so this is the Board of Health meeting. July 11th, 6 p.m.
And Trouble's at the door.
Oh,
You're all set. They're
okay,
gonna edit that.
thank you.
You guys are good?
Yes,
Good.
thank you. Thanks for checking.
Yeah,
Um. President Immer meeting, not in land use room, or meeting in this little office.
conference room two.
Conference room two. President of the meeting is Sue Braska.
Terry Putnam.
Tom Hibbert.
Sorry, I was muted. Kayleen Simons.
Simons, okay. We don't have any public comment and we don't have, Trish is not here, so she did submit her nursery report, a hard copy, which Tom has a hard copy.
Yep.
And we'll attach that to our minutes from today. And the minutes from June 6th. Did anybody have any changes, questions?
I don't think I had any changes.
Have no changes.
I'll make a
I
motion.
move that they be accepted as written.
I second that. All in favor?
I,
Sue Braska. Yeah. Okay, so it's June 6th.
You have a copy there.
Which I'm gonna send to Cindy and ask Cindy to,
Perfect.
but she will do the nursing report.
Yep. I'll give that.
But, okay, but you did email me the nursing report,
Yes,
so I can email.
I just emailed that out.
Email all that to her.
And I can leave her these hard copies as well.
so this
Yeah.
was the one from this, we've got that in our,
So I have another hard, but she needs what, 3 hard copies
I don't know. I'll
for
give her
our
both.
file?
Yeah, I'll give her
you
both.
need another, you need mine, or I'll give you
Do
my
they still
file.
need hard copies for the other select board and town clerk?
I don't know. I think so.
Okay, so,
But she can make copies of.
yeah, but anyways, there's a copy. And
And I have one here.
copy. All right, now, we have to discuss officers. Terry, would you like to be chairperson?
Would I like to be?
Yeah, I'm not gonna force you, but if you, if you. I mean,
How much outside, I know you do a lot outside. Is my working, out of town 2 weeks? I am fine working with you as vice chair if that's,
okay,
but, I totally want to respect, you've been chair for a long time. But I would, I worry about my schedule, being
Okay.
able to fulfill your responsibilities.
all right, so do you want to make a motion for chairperson and vice chairperson?
Do I move myself?
Yeah.
Okay, I move that Sue Braska be chair and Terry Putnam be vice chair.
Okay, I second that, so all in favor,
Terry Putnam,
Sue Braska, yes. Okay, so
Okay.
that takes care of, it. Okay,
are you okay with that? I'll help you. I can help you with whatever burden you want to turf off. I can take minutes, I can do whatever you want me to do.
Okay. all right,
So think about that.
Okay.
I'll help you any way I can.
thank you. So review of the tobacco and food regs, can we look at the food regs first?
Sure.
I said,
Is this one with the yellow?
everybody has the original.
Yeah.
Yeah. and
The
then-
yellow, and then there's another one that is the anti-choking regulations, and they
Yeah.
kind of go together,
Okay,
but
So
they're separate.
these food regs are what we had before. I just put them in a better format with purpose authority and I kind of separated them. And what is new that I added is in yellow. And basically what I wanted to add was that they had to have the food protection manager's certificate, the allergy awareness training, and the other one was the choking. And since we have the choking regs that I copied from Westfield,
Hmm.
Except I made the change where we want anybody,
Right.
even if you have one person sitting there. Cause the Mass General Law says a capacity of 25, then you either have to have a choking device on hand or an employee working each shift who knows how to do one of the manual methods. So this food reg, I wasn't sure how to word or device choking, choke saving training certificate, but.
You
um,
could, we could say, and, if we pass both regulations.
think we have to do
And
both.
demonstrate compliance with Southwick Board of Health anti-choking regulations. And they would either give us copy of their training certificates, or when I go there to, or I guess they could submit their receipt for the choke saving device.
Okay, yeah, that's a good way, that's good. So instead of device choke saving training certificate, they have to demonstrate compliance with the Southwick Board of Health anti-choking regulations. That's good.
Yeah,
All right.
And that would entail, they'd have to know how to work the device, right?
yes, I
Because
believe
you could
so.
have it and.
Right, and not know how to,
Not know,
how to
like you
use
can
it.
have a defibrillator and not know how to
Right.
use it.
Right,
Okay, so we'll get to the anti-choking things.
Yeah.
So then, I did the authority under the Mass General laws. Now I was looking at our disposal regs,
Mhm.
and this Mass General law that's cited for the authority is incorrect.
Oh, okay,
But this one I looked up is correct. And then I wanted to put somewhere that these regulations superseded the other regulations,
okay,
so I stuck it in there. I mean, I
Yeah.
think we can put whatever we want. And then under the penalties and fees under A, I added or lack of proper
yep,
certifications. I just kind of made it vague.
Yeah.
Because I didn't know how to put it all. And then I have on there referred to the Southwick Board of Health choking regulation, but I don't have to say that now because we said in compliance with.
Yeah.
So I can cross that out,
Okay.
that note. Okay, and then number 2A2, I added the certifications.
yep,
And I just, instead of may, and I put received, instead of some words, instead of shall, I said may
yep,
for the first one, and then, initiate procedures for closure. And then number B, letter B, is the same as it was.
Except instead of will.
I
we're
put
doing
may. I believe it's the same as it was. I might have moved stuff around, and I think I added 5 and 6. Cause I think 5 was just a paragraph stuck in somewhere, and I put it under 5, and number 6 was just, I think, something stuck in up here, and I put it under a number.
okay. Just one, I'm just kind of looking at this now, one wording I thought of that might flow a little better is if we said, in the case of delinquent payment for a food establishment renewal or an incomplete application
Under B,
under A. And then we could even do a separate sentence, say, an incomplete application could be missing signatures, non-included attachments.
with payment for food establishment permit. Lack of proper certifications. Or
Or an incomplete application.
have to put food establishment permit.
Yeah.
application.
Yeah.
Okay. Does that sound good?
Yeah.
All right. And then. 4, 5, and 6 are the same,
Okay. Cool.
and I already put down, what, I just, how we were chairman, vice chair, chairperson, vice chairperson.
Okay,
And this is something. If we decide we want to go with this version, okay, we let. I don't know if we have to town council review this because it's basically the same thing, but we're
Yeah.
just adding a few things.
Yeah, I think it'd be probably worth sending it out to them and they might say, oh, you're barely changing anything, you're fine.
Okay, because then we wanna. Put it in the as
Yeah.
we posted.
So I printed up the guidance on new regulations, so, cause I haven't gone through this process myself before. We did it in Westfield, but I wasn't in charge. And so technically, it's not advised, but technically it just has to be during an open meeting to adopt new regulations, but they always advise posting it in the paper and doing a hearing.
Yes,
You're only required to do a hearing if it's a Title V regulation. But that being said, I think we should still do the hearing
Yeah,
just because
yeah.
I don't think we're asking anything that crazy, but it affects restaurants in town, and if they don't like it, if they don't think it's reasonable, they should have a chance to let us know before.
Now, do we have to post it twice?
Yes, posted, the hearing notice must be posted in a local newspaper at least 2 successive weeks before the hearing. Though not required for other local regs, the hearing is always a good idea.
Successive weeks, so say if we're going to look at this, I'd like to put this into effect for this coming,
Right, before January.
before we send things out in October or
Yeah.
November, whatever, we're say November, if we're gonna send them out.
Yeah,
So say we're gonna vote on it in September, then we wanna do the middle of August, the second week of August and the third week of August. And they say at least 2 weeks or can be more.
at least two successive weeks before the hearing.
All right, so it would have to be the third and the fourth, and then we meet
Yeah.
on the first.
Yeah,
And we can post it. Does it say where we can post it?
posted in the local newspaper
In 2 places or once?
both times. But it just says, this is just a guidance, so I'll confirm.
I think I might have information
Yeah.
too in here. I'll have to look it up later. So we can post it.
So what is our local newspaper? Is that
Westfield
Westfield or is
Evening
it
News.
I think
Can you
Westfield,
say it?
Springfield?
yeah.
Westfield Evening News.
Well, I think Westfield Evening News is now in the Republican.
We don't do paper.
Oh, okay.
I know, we just get the Thursday paper and the Westfield Evening News comes with that.
Okay. Yeah,
And those are kind of,
yeah. And I'll find out. I'll talk to select board and see if where they've been posting legal.
because it looks like that, nowadays you could put it on the Southwood community page or something,
Right,
there should be electronic means
Right.
and not, because people don't.
And then when we could post it out here too.
right.
So we'll
Yeah,
post it.
and post it, we could post it on our website and,
Okay,
Do we also send, once it's sent out to the local restaurants as well? Once it passes, what's the process?
I think, let me make the corrections and then I'll send it to Tom.
yeah. And then we'll,
Tom can send it to the attorney.
attorney, yeah,
And in the meantime. Yeah, we could we should probably send it to them to let them know proposed.
yeah. Yeah, once we decide on our hearing date, we could send it to all the restaurants.
I mean, that sounds logical, but I just asked
Right.
a question.
Yeah,
I'm not saying we do that, but if they don't take a newspaper.
right,
How are they gonna know
right,
anything that's coming?
yeah. Yeah, the law hasn't caught up to what we do in modern
Yeah.
times because, a lot of towns don't have a local newspaper anymore. No
So it'll
one,
be Westfield Evening News.
Yeah,
And
so-
you can post it here. You can post things in the lobby, right?
I think so, yeah.
And does it go on the website as well? I mean, does it?
Yeah,
go
we
on
can
the town
post
website?
it on the website.
Yeah.
So then we wouldn't have to print it out for the rest. We could just send the restaurants a postcard. We don't have to send them a whole packet with everything. We could just say, proposed regulations are available on the website. Give them a link. And then that way, if they want to read them, they can.
And I know the select board, posts agendas, posts things like that on the
Yeah.
Southwood community page.
Oh, okay.
Because they remind people of meetings and they post links and all of that. as
Okay.
well, so. But
Good.
yeah, I think that would be,
Yeah,
refer them to the page. too.
yeah,
I think that would be good.
Okay, so hopefully that'll take care of those certifications and we'll get them in.
Yeah,
I didn't change the fees or anything.
Yeah.
They're the same.
yeah, that will be good because it's like just for the background. We always have stragglers with their getting in their application, or they do the application and the check, but they don't have their serve safe. They don't have their choke saving, they don't have their allergen. So our kind of past practice, and it was a little vague in the regulation before. So the past practice was if you turn in your application and your check, we won't fine you because you've done 90% of it, but frankly, you didn't do all of it because we still need those certifications before we give you your license.
Yeah, and if something happened, like what if there was some kind of
Right,
foodborne illness or somebody did
Or
choke?
somebody died.
Right.
Yeah.
right.
Or
That
something.
might come back to haunt
Yeah,
us
Right.
and
too.
it's like, and then they'll
Yeah.
come back to us that
Yeah.
they have
Yeah, so
the training, so.
so this way it will be clear as day. We're not gonna give you your license. We're not gonna, and we're gonna fine you until you turn this stuff in. And it's, I know restaurant owners have a lot, and everyone's having a hard time with staffing right now. But it's really not hard to get these certifications. The Serve Safe, it used to be the case that you'd have to find a class being offered. You can do it online. You can do it on a webcam, it's proctored. The choke saving, there's a few different choke saving trainings. One of them costs, I think, $20 and is like an hour and a half online training. So
Well,
there's not the excuse there used to be of, I can't find a class. It's online, you can do it. You could have it done over a weekend if you needed to.
and I compare it to hospitals who suffered through COVID. They lost staff.
Right,
But they were still expected to keep up with
right,
the training, keep up with the care of patients. And if you open a restaurant, you have to take care of the people that you're serving.
right,
And your employees.
Right.
Still think about what you talked about at last month's, and I haven't been back there since. And that's, that's kind of a symptom of
mhm,
not having the right training or the right people
Right.
there.
Okay,
right,
so the choking ones kind of go hand in hand, and I copied Westfield's with just a few changes, and Westfield just took the Mass General Law
yeah.
and stuck and.
Just, I didn't look at it too much, but does the Mass General Law allow the choke saving devices?
Yeah, if you look, we'll look it up.
Because I had looked at the law that says that they need the training, but I didn't see anything about the devices.
Mass General Laws, you can look it up, chapter 94. They didn't list, I listed the choke rescue methods that I took from Westfield, which are not in the Mass General Laws.
Oh,
Just that
okay,
just the first paragraph that you sent me is in the Mass General Laws.
okay.
And do we need to stipulate that we're not talking about just adults? I mean, they have to be able to save children as well. And I'm not sure the choking devices work with children. They could be. I don't know. I'm not familiar enough with them.
I'm not familiar with all of them, but someone actually gave us one when our baby was born. And I don't know if it's a separate mouthpiece or if it does work for children, but
Depend on how much force and everything, because that's.
yeah,
Westfield also listed the training
yeah,
that you can go on.
Mhm.
yeah.
Did you?
But I
did you
do,
Look it up, chapter.
yeah. Section, oh, sorry, I did.
Because there's always a fear of lodging it further.
Yeah. That's
Yep,
from
a
a DICE
approved by
approved.
the Department of Public Health, designed and intended for the use of removing food. Exactly how it's worded here.
Yeah, okay. Mass, what was it, 605 CMR?
305D, section 305D, it's right here.
No, there's a separate, the approved manual choke saving procedures. There's a regulation too.
Yeah, all I list here is the
I just-
Heimlich and the sequence. Oh, yes, that's right, I looked that up.
Yeah,
It's the Heimlich maneuver and the sequence of obstructed airway maneuvers. Or the Massachusetts Department of Public Health approved manual procedures. Did you find
shall
that?
keep a list, okay. That's it. See, that's interesting, because the 105 CMR 605, that's what's referenced in the food code. But then the trainings. Then the 305D is the Mass General Law. That says it can be the device or the trainings. So they technically would be compliant with the Mass General Law, but then not the Mass Regulation and the food code. So I'm glad to see that the general law clearly says either or. But I'll run that by like the Mass Association of Boards of Health or something to make sure, because in most cases you can't be less restrictive than the regulation. The regulation just says they need the training.
But we could be more restrictive.
We could be
if
more
we don't-
restrictive.
we gotta have the training in the device.
Right, we could say they need the training in the device, but I do like the idea of the device. Because technically with the training is we're saying they need to have someone at all times working that is trained in choke saving. And it doesn't necessarily have to be full CPR. It can be, they offer trainings just on the Heimlich and sequence of obstructed airway. But a lot of times it's easier for people just to get CPR because that's included. So I know in some smaller businesses, it's harder for them to guarantee that they always have an employee that's working that has that training. So I do like the idea of the choke saving device that can, kind of cover them and protect their customers and protect the public without necessarily having to have them, have every staff member get CPR, because that
But I think we have to stipulate that they have training on that device. Again,
right.
I could have the device on the shelf and have employees that never,
Right.
Temporary employees, and they're the only ones. I think we have to somehow
Right.
stipulate that it's not just getting the device.
Right. Yeah. Yeah. And I don't think they would be necessarily get a certification on that. Because like I said, someone got us the life vac, and the company had whatever device they get, the company has videos. So they can make all their employees watch
Or the restaurant owner
Right.
goes over, gets trained.
gets
and
right,
over
goes
everything.
over, yeah.
But keeps a list. of
Right.
who's he, she, or they have gone through
Yeah.
it with.
Okay. So I would want to run before we say,
It just says here, records of both types of training and certifications shall be kept on file at the place of employment, readily available for inspectors, and I added, and at the Board of Health office.
oh, okay,
When you say, it already says at the top of page 2 that they have to watch the training video from the manufacturer. So as long as
okay,
we're good with that.
yeah,
I've been in too many places where they have an AED and nobody knows how to work how to work it. So
yeah,
Okay, then I list those two, life act and dechoker choking. I haven't looked those up yet, but that's what Westfield cites.
yeah,
Plus Westfield cites the video or whatever, but they can find that. And then
yeah,
then that that other one, the manual one. I should I, cite that? Mass General, that state. that
Yeah, we
one?
could say that as it's 105 CMR 605.
CM 605, and what's the name?
The name is Approved Manual Choke Saving Procedures. With a hyphen between choke and saving.
So I'll put that in under choke rescue
Yeah.
methods. The non-criminal disposition. I copied what we've always had in all of them, and then I just said that the fines to refer to
Okay, yeah,
the food regs.
perfect. So,
In
so,
Westfield, when they met, Westfield's is just one paragraph, they didn't.
yeah, they didn't split it
divide
out.
all up.
So my other concern or thing I want to look into before we fully go forward with this is that the reason I mentioned the Westfield one to you was because previously there was nothing about the devices, but their regulation previously was about it. If there's any seating on site, they need to have it. So if it's a place that's exclusively takeout, they don't need the choke saving. But if they have one seat for someone to eat, then they would need the choke
Like
saving.
malicious, that's picnic table.
Right. So
If we choke on ice cream, no.
yeah,
They have other stuff too.
they do.
So how should you word that? I said each restaurant, no matter the seating capacity.
Yeah, so I think it would be
So you don't need takeout.
each with on-site dining or something like that. But
Or you could say no matter the on-site seating capacity, so I would just insert on-site.
yeah,
No matter.
yeah, with
the on-site seating
yeah,
capacity.
or with each restaurant with on-site seating capacity, something like that. So but when they adopted their new regulation with the devices, they went back to 25, which is consistent with
Yes,
with the
the
law.
25.
So I want to try to find out from them why they did that, if there was any sort of legal decision or if it was,
Are you writing all these notes down?
Yeah, I
All
will.
these things you have to look
Yeah.
into.
Because if they could have got advice from the law department or from MAHB that said, that's you're on some shaky grounds there with saying, and with any seating, they need to have it. Or maybe they just wanted to be a little more friendly to the businesses and say, if you got less than 25, we won't enforce that.
All right, so you're gonna check that and you're gonna check the discrepancy between the state and the Mass General
Yeah.
law.
And I would kind of go, I would go along with what Sue said earlier, if you got one person and that one person chokes.
Yeah,
I don't see how you. can
Right.
Arbitrarily just put 25 on there.
Right. CMR 605 and chapter 94. Section 305D. Okay. So those I will confirm. Anything else on either of these, either the food permit or anti-choking?
um, let's see what other questions I had. Just make sure I didn't word things too complicated, like the purpose.
No, I think it's-
Yeah.
The authority. Oh, yeah, the authority. I had,
Under which one?
following sex, under the choking.
Okay.
Has adopted the following regulations to provide, I don't know how to, names of registered FDA devices designed and intended for use in removing food laws and to mandate anti-choking training for all food service establishments. Cause it says here, well, it says here the, in a couple places, does it say the Mass Department of Public Health has to list the approved ones?
Yeah,
So maybe we want to say approved FDA devices, because I'm sure there are more.
right, there will be more at some
Yes.
point.
Approved FDA devices.
Okay, I just said registered. Names of approved. Where do they get this list? I mean, I put the two down from Westfield, but where did Westfield get those two approved?
Right,
Says here they are registered with the FDA as devices. Let me see what Westfield says. There's, yeah, I think I took that sentence right from them. Yeah. And then they list the training courses for the light back and the dechoker. Which I don't want to list them in case things change.
right.
But what do you think they
Can see.
got those? Oh yeah, did you Google it?
I just Googled it. On the FDA website, there's FDA encourages the public to follow established choking rescue protocols. Step-by-step guides approved by Red Cross and American Heart Association, relieve airway obstruction. These protocols include abdominal thrusts, also called Heimlich maneuver for children and adults. These protocols do not include anti-choking devices. The safety and effectiveness of anti-choking devices that are being sold over the counter have not been established. They are not FDA approved or cleared. Consumers should be aware that using anti-choking devices first could delay action, as consumers usually have to take them out of packaging, assemble them, and follow device instructions, which may delay the use of established rescue protocols.
It doesn't list the ones they approved, does it?
No,
So how did Westfield get these two names?
right.
Unless they looked up anti-choking devices and then looked to see whether they were approved.
I just looked under 105 CMR 605. And it's approved manual choke
Yeah.
saving, and
Yeah.
they're saying,
Heimlich
you know,
and
what
I already added, I think.
approved Heimlich and the sequence of obstructive airway maneuvers. But they don't reference.
There's, when I go back, there's life back or back life.
There, when I Googled that, there was something saying a controversy about the LifeVac device. Was it able to remove cashews or whole grapes?
Yeah.
So there's,
So maybe we don't.
probably not.
Yeah, maybe we don't want
Um,
Right
Maybe-
there, life back.
to like that.
they approved anti-choke.
Yeah,
So this was FDA.
that's the one. This is the one that we got. Someone got for us. We obviously haven't had to use it, but we did watch the videos on it.
We've that too. I got one of those for us if one of us is at home alone
Yeah,
for that. Not that I would know how to use it. I'm sitting here preaching about knowing how to use it. Um,
This is the UK website. Yeah, I couldn't find anything from the FDA.
Encourages the public to follow established choking rescue protocols. So that's the protocol for adults choking children and choking infants.
So records of both types of training and device certifications. And device.
Yeah,
Certifications, approvals to show that they're approved.
This is saying the FDA is working with manufacturers of anti-choking products to bring their products into compliance. So we might not want to just go from Westfield's on.
Yeah.
We need to, and this was dated April 22nd of this year.
yeah, that's recent.
So, yeah, they recommend, as of April, the safety and effectiveness of anti-choking devices that are being sold over the counter have not been established. They are not FDA approved or cleared.
So we
So
indicated here
it's
that they have to be
It's the Heimlich and
the manual.
the Heimlich and the anti-choking, the protocol to rescue adults choking children and infants.
Yeah,
Yeah, so I would. If you choose to use an anti-choking device, only use it after established choking rescue protocols have failed. So they're kind of leaning toward make sure there's training
yeah,
for the manual.
Which
Yeah.
is that you're looking at? What's that you're looking at?
FDA
yeah,
in an article from April 22nd.
yeah, yeah, that's what I got here.
And we could even go as far if we wanted to. I'm downloading the protocol to see what it looks like. We could even go as far as to include that as attachments if we wanted to.
Oh, okay,
So
It's Red Cross. That's what and they are differentiating between adults, children, and infants, and it would be my bias that we probably need to outline that it's not just a one and done.
Yeah.
We need to know.
yeah. I'll reach out to DPH either way and see if I can get clarification because, the food code in 105 CMR says just the training, and then the Mass General Law says training or, so
I think if you
And
go against the
But-
FDA, we're
but yeah,
probably
that-
good.
And
the
FDA
the FDA is saying
says
those
if they
things,
do the manual, try the other one, the manual doesn't work.
right? Right,
And it says the FDA will keep the public informed if significant new information becomes available.
yeah,
So
And-
is that just an FDA notification that went out?
No, this is on the FDA site. I Googled
FDA
manual. I can send you the link.
Okay,
so yeah, maybe we'll scrap
You've got that link, so you're looking at the same thing. I'm
Yeah.
looking at.
yeah,
It's it's an FDA.gov, so it's
yeah. Yeah, maybe we want to scrap the choking devices then. But as I was searching it, this is one of the courses, this is the online course. It's valid for 3 years, takes 1 hour, and it costs $20.
so essentially $6, $6.50 a year. Yeah.
Right.
That's-
Yeah, so they cover choking overview, choking hazards, choking response steps, Heimlich maneuver techniques, and CPR for unconscious individuals. So
okay, so go back to the food regs and, so do you wanna say? The certifications, we need just a choke saving training
Well, maybe
certificate?
do you want to wait until
Yeah.
The questions answered, and then we can just take that, we could take those out.
Yeah. Yeah, because then we could take out
Yeah.
this and then just say certificate of allergen awareness and
Some kind of choke saving training.
yeah,
What's the title of this? What was the title of this one?
this one is choke saving procedures, and then this law calls it approved manual choke saving procedures.
Yeah.
They need to have someone trained in the approved manual choke saving procedures.
And they'd have to have that every shift they're open.
Yeah. Yeah. So yeah, we might want to change that, and then that would be easy enough to just add a separate another section or another paragraph that just says instead of doing a separate regulation and just saying choke saving training is required with any on-site seating, even less than the less than 25 seats. We could do that and just do it in one reg. So I'll get the feedback from MHB and DPH and whoever we need to get it from, and we'll go from there.
So Westfield might be hanging out on a little.
Yeah,
bit.
well, I wonder what
Because you wonder if Massachusetts law was based on any review, medical review, because that.
here's their regulation and April 1st. So
Yeah,
they passed that before the
Yeah.
FDA.
And that is a safety communication, so that's kind of that's an addendum to whatever they
Right.
probably had some issues come
Yeah.
up, and so they felt like they needed to,
Well, yeah, they have
Yeah.
a whole section, potential problems with the
So-
devices.
can't picture this being resolved quickly.
Right.
So we're gonna say, the certification, then we'll say just choke saving training
Mhm.
certificate. Choke saving training certificate.
Yeah.
Okay. And then we'll say, and then you'll put the note that choke saving training is required for any restaurant with on-site seating.
Mhm.
Yeah.
Mhm.
But you were gonna check about the 25 seat thing.
Right, just to make sure there's not
So right
There's not a
there,
legal, yeah,
certificate.
I have that written
Right,
down,
Sounds
yeah.
like if Westfield's doing 25 and they're also doing I'm not sure they want to be, we want to
Right,
use them as
right.
our model.
Yeah, well, the 25 is consistent with the state law. That's what they say, so. Previously, they were more restrictive. And then now they're equally restrictive, I guess, as the
I mean,
state
we
law.
have a lot of restaurants around here that don't reach a 25 capacity
Right,
at any given time.
Right, yeah, there's a good amount that don't
With
have
lots
it.
of nut stuff.
Right,
And,
right.
and things you could be at.
Yeah, and
So we're talking about on-site training as opposed to summer house, they're outside.
no, that's
No,
still on
that's
site.
on-site.
Still
Yeah,
on site,
yeah,
Yeah.
okay.
yeah,
Because they would
But-
still, if anything happened to them, they'd still be responsible.
yeah, yeah. Yeah, because it's on the site is the whole property, so. So I
For all
think most,
restaurants with on-site seating.
yeah,
All right, and then,
yeah, and we could even, depending on what the state does, I'm like another option could be, we could say like 10 seats or something, because I don't know if we say any restaurant with on-site, is that gonna get into like the gas stations? Well, the Notch definitely has, they probably have, well, they probably don't have 25 seats at this point, but they have a good number of seats. But then like the Pride just has snacks.
they don't
Just-
have,
yeah.
Pride shouldn't have any seating.
Yeah, because they're
because of
septic,
septic,
so
they shouldn't have seating.
yeah. But I'm just trying to think of anyone who might not really be much of a restaurant, but might have a couple seats. I don't know. But yeah, I'll look into the law behind that and see what we want to do.
Okay, but I'll
So-
retype this.
Yeah,
I think if you have to permit them, maybe that, if we have to permit them.
Right.
Then they have to qualify.
right.
So we won't worry about the choking, because we'll just add that
Yeah,
general
yeah,
comment in there.
Sounds good.
yeah. So we'll procedurally, so we'll do some research. We'll have another draft at our next meeting. And if everybody likes it, then we could set the hearing for the September meeting. Is that
Well,
so we'll talk about it next.
Or we can go with the changes that we made for the food regs. Go with the changes there, so type it up, but then if you find out something different,
Right,
we'll change it. I just don't
Right.
wanna waste.
yeah. But we had said we would post in August anyway, so we'll discuss the draft in beginning of August. Our meeting, I think, is actually August 1st is what our next meeting will fall on. And then at that point, if we've answered all our questions, we could
But if it
decide.
goes to the attorney, you don't know how it's gonna take.
Right, right.
But if it goes to the attorney, we could still have a hearing, right?
Oh, I think so.
We can still have a hearing and everything, because we're not voting on it yet.
Right, right. So, yeah. Yeah, okay,
To get, if anybody wants to add.
right. Okay. So, all right, so tentative, I'll write that down too.
So can we look at the date in September?
Yeah.
Jim and I are in Greece.
Oh, okay.
In second weeks, but I could do the third week.
Third week, and start the Big E for 17
Oh, yeah,
days.
I forgot about that. I mean, hopefully we have the third member.
Who can come at 6 o'clock.
Yeah, so you're the first 2 weeks you're out of town?
First 2 weeks of
Okay.
the country,
Saying what, starting what day?
the 1st
Oh,
of September, and
Okay,
we're back on the 15th.
Big E starts that on the 13th.
Now we could, it's not exactly September, but it would be 4 weeks. Could we do August 29th, or is that in
29th?
violation?
No,
no,
we can say.
Yeah.
Because I could do that.
we,
August 29th is what day?
Is it Thursday?
we could also. If we did the hearing and pass the regs in October, it's getting a little tight, but that's still enough time before renewals get sent out to have this passed and that might give us a little more time if we are going back and forth with the attorneys and everything.
But let's meet, can we meet the August?
Yeah, we'll
29th?
meet. We can do that if you want.
That'll be 4
That's- yeah.
weeks from we'll have the August the 1st is Board of is a meeting, and then that's 4 weeks later.
Yeah,
Yeah.
let's do that.
3, 4, it's actually 5 weeks later, so it's like the start of a,
Yeah, okay,
And then
sorry
at
about
meeting-
that, but that,
And then at that meeting, we can just see what we're gonna do for September, whatever.
yeah,
So you just have to let, whoever posts
Yeah.
or we can meet, whatever room.
so put that on.
sorry about that. but
That's
we-
okay. So we'll still meet August 1st
August 1st and then.
and then
I'll be calling in for that.
Okay,
August.
And then the 29th will be
I'll
wherever
be here.
we can meet,
29th.
whatever room's available.
Okay.
Just have to let them know.
Sorry about that. but
That's
thank you
okay.
for-
No, that's good.
I'm glad we looked ahead.
Yeah, I love you guys, but
You'd rather go to Greece.
yeah,
Yeah.
I'll think about you on that
Yeah.
Thursday. How's that?
Thanks. I don't blame you.
Okay, so I'll retype that up and you're gonna get going on that. So you can get moving on that. Okay, then the tobacco reg.
So the tobacco regs, so
I
um
start,
I put it in my email. That was our big question, was the green and the yellow. And I don't remember which one was which. Cause I didn't print that email out. I can pull it up. There it is. So the yellow highlighted sections are copied directly from the DPH regulations.
So DPH.
And the green sections are uniquely local policy decisions
So we can,
to be made by the Board of Health.
so then the yellow, we don't really need to focus on because that's regulation, right?
Right.
Okay.
Okay, so looking at these. Do we need to have all these whereases? No, do we need to have two
I think,
pages,
I think so.
3 pages, 2.5 pages? Do we need that?
I think we do.
But when you look. Doesn't have whereases here. For the state.
Trish. Trish just emailed me for the Zoom link.
How you doing, Kayleen?
I'm good. How are you guys?
Busy week?
Yeah, a little bit. Got up to Blandford to talk to Jennifer, so that was good. So hopeful for the programs coming out for the board, so should be good.
And then we don't meet again until. September, right?
That's what it's leaning towards, I think. Summers are hard. Everybody's
Yeah,
on vacation, and it's busy. I get it.
No, we found that all year was hard,
Yeah,
not
I'm
just,
seeing that. Yeah, it's hard.
so we should talk about, Monday night's not good for me, Tuesday night is not good for you, Wednesday you have choir practice, so Thursdays,
And Friday, no one.
no, I'm
works.
not gonna Friday,
No, but you
so
know,
it's Thursday.
it was posted, I knew before I came on the board that it was
Yeah.
gonna be Thursday.
Okay, so it's, well, I'll tell Tricia that that's how it is.
all right. And she just emailed that she didn't have the link, so I just resent it to her. So she
All right, do you have the,
calling in soon.
You know what we could do about the statement of purposes? You could put one whereas, and then the rest of this stuff is bullet point.
Yeah.
You don't have to start
I
a
don't-
sentence
I-
with a whereas.
I get nervous changing because this is like consistent
Is it
across
like a
the state.
Then I'm-
And it's been reviewed by the state attorneys. It's probably every other community has theirs written like this, so it is kind of,
then whereas it is.
Yeah.
okay, so shouldn't the, sale of tobacco, restricting the sale of tobacco products and nicotine delivery products? Shouldn't that be the title?
I think I think they've changed the definition of tobacco products to,
Is that under one of these definitions?
yeah, a tobacco product may derive from tobacco or nicotine that is intended for human consumption,
Oh, so
whether smoked, chews, includes e-cigarettes, yada, yada. So I think they've, instead of including the nicotine delivery product, I think they've just lumped it all into being called a tobacco product based on their definition.
Okay, so what wrap? Let me see, electronic nicotine delivery system, and a question mark on that, now why?
The definition?
Yellow is DP.
DPH.
Okay, so I guess it's,
Yeah.
there, forget it. Page. It's under the healthcare institution. The green.
Yep.
What page, what page?
No, there are no page numbers.
Pages are numbered, but it's on definitions, healthcare
Oh,
institution,
definition, okay.
and it's in green about a retail establishment. Do we really need that there?
Why do we really?
I mean, I'm not even sure what what that sentence means.
Healthcare institution.
Do we refer, do these refer to a healthcare?
Oh,
institution?
so, okay. So I think we had talked about doing the ban in healthcare institutions. Or maybe we had already done that. Yeah. We might already have that. So no healthcare institution in Southwick shall sell or
So-
cause to be sold.
So
So
we can take out this green thing.
yeah.
Okay.
So that green thing would be an exemption for an optician, optometric, hearing aid facility, or audiology services. And I know there's a hearing aid place in the Gristmill Plaza.
It was
I don't know.
a petition, but I don't know.
Yeah.
He retired.
I'd be surprised if they sold tobacco, so I don't think we need to give them a
So I never saw.
yeah. Because the way I'm reading that, a retail establishment that provides optician, hearing aid, audiology, etc., is not considered healthcare. So
So they wouldn't be covered.
so they could sell tobacco. No, we could, if it's green, that's our decision,
Oh, we
your
can put it
decision
in.
to make. So we could put that in.
Now, are these already decisions that we already discussed and decided either yes or no, but they put them in anyway?
I think we had tentatively gone through that checklist.
So these are the ones were these the ones on the checklist?
I don't
that we
think
decided
this
yes or
retail,
no?
this exemption, I don't think this was in the checklist, so I don't think we had decided that yet.
Okay, so oral nicotine pouches,
Well, I remember us saying something, I mean, we were good with the blunt wraps, right? I'm back under authority, I'm sorry. And the tobacco
And-
leaf and kits and all that, I think we were good with that, right?
Yeah, and just
these are just definitions, so.
for clarification too, I had we had another tobacco violation, which I'll get to later. But when I was emailing with Meredith O'Leary, the Northampton director, who's also the director of the Pioneer Valley Tobacco Coalition, who does our tobacco inspections. I had sent her our draft reg that we got from Mass Health Officers Association. And she thought it was good, but she also said she's willing to attend a meeting and answer any questions that we have. So we could have her attend the hearing, we could have her come to our next meeting. Because she's definitely more knowledgeable than I am on, and they actually do the inspection, so they might have some input where they say, oh, there's a bunch of places that are selling blunt wraps, or whereas I could find that out, but I don't know that.
Was she one of the ones that we talked to?
Yes, she was at the hearing. She was it was her, and I think one or two of the inspectors were there as well at the hearing.
Yeah, I remember.
They all
that.
called in.
Okay, so these really definitions are just definitions, so that's fine.
Right.
So when we
Okay.
get to number D, which, can't tell you what page it's on.
Okay.
No tobacco sales to persons under 20.
Okay, wait.
This, they keep
Okay, here we
saying
go.
or born on or after January 2. I'm getting rid of that.
Yeah.
I mean, or if you're 21,
Under 20,
21, so every
right.
time that's listed there or born,
Yeah, because it's
I'm
up
just
to
getting rid of
it's up
it.
to the establishments to be able to figure out
I'm getting
Right.
rid of
between
that.
one.
And then we'd have to update our reg
Every
every,
year. Yeah, so that doesn't make sense.
I think, sorry to interject, I just listened to the nicotine-free generation webinar with the state.
Mhm.
That is actually part of the nicotine-free generation. So that's a policy that the town can put in if they want to be a part of the nicotine-free generation. So it would be anyone from that January 1st, 2000, they would never be able to sell.
Oh,
So that's your decision, either 21 or older, or be a part of that nicotine-free
oh,
generation.
so it wouldn't be something you update every year. It would just mean if
That
you're
means
over
your
that
town would
age,
no longer sell to that generation.
25. Wow.
Yeah. I just learned that today, so that's funny that that came up.
Thank you.
Yeah.
Okay.
Wow.
So I
So
don't know,
that's your town's
Yeah.
decision. So obviously,
Yeah.
you guys.
I don't know, so how do you feel? I don't wanna do that.
Right,
And
That's,
someone's over 21, if they wanna smoke, I mean,
that's fair.
that's up to them.
Yeah, I think that's tough for us to enforce. I think that,
That's what they were saying at that webinar, that
Yeah.
that would be difficult.
yeah, maybe if they do it statewide, then
Yeah.
maybe, but
Massachusetts might eventually do that, but not right now, obviously.
Yeah. yeah.
I wouldn't want to be on the forefront.
Mm-mm.
of
No.
that.
That would
That's-
come with some pushback for sure.
So then tobacco product sales permit, what is the name of our permit, do you know? Off the top of your head? Anybody?
I can look it up quick. Hi, Trish.
Hi, how are you?
Good. How are you? Let me
good.
put Zoom back up so we can all see you. Nice to meet you. I'm Tom, the
Hi.
health director.
Sue?
And I'm Terry. Nice to
I
meet
see
you.
Same here.
Tom's gonna send out, or maybe you already did, email a list of.
Oh, I didn't send out the
all
contact
all the
list, but I do.
contacts with our emails and phone numbers and addresses,
Okay.
so you'll have. We did talk a little bit about, our meeting. That's our farm.
Oh, really? Oh, cool.
Our meeting, on Thursdays, and Thursdays is the only good day for Terry and I. And it's been Thursdays for, I don't know how many. For years.
That's okay. It's fine. I just sometimes I get out, I'm in the operating room till 7 p.m. And sometimes it's give or take. So it could be a little earlier or later. I'm okay with joining a little late if you guys are okay with it.
Okay.
It's just a problem when Terry travels, she's with Jaco.
Mhm.
And she can't, she's traveling, she can't zoom in. So it'd be a problem there, but we would need you like at 6.
Yeah.
And if we pushed it off till 7, then the time makes a long day for Tom, he just has to stay an extra hour.
Yeah, I'm not sure how to fix that.
Yeah. We can do some, I think, we can do some trial and error, see how it goes, and if we know if we know Terry is going to be traveling for a meeting, then maybe we could do it that month. We could do it at 7, sort of thing. But we can play it by ear and see what works.
I think you've only missed one.
Yeah, it's
Meeting
usually
where you-
Thursdays. I don't try. I mean, I'm not in the airport on Thursdays.
Yeah.
So in one
So
day, I
that's
think you were
usually-
flying.
Yeah.
Okay.
Okay,
And the other thing is, you know, when I was kind of talking a little bit about this, the schedules are so embedded in the town schedule, you know, the room schedules and things like that. I think that makes it a little more difficult to change.
Yeah.
also, so do you go by Trish? Trisha?
Trish, correct.
So Trish, also on, our Zoom is Kayleen. Kayleen is our shared service coordinator for our DPH grant.
Sorry,
Okay.
hi. Nice to meet you.
Hi, nice to meet you.
And she just recently started this past, in
Okay.
June.
Yep. Yep.
And Kayleen reports to the towns, what's the big name you gave it?
The so yeah, so I'll just give you a little overview on the DPH grant. So it's we call it the Western Mass, or no, Western Hampden County Public Health District. So DPH has this grant program that they're doing all over the state, and they're encouraging health departments and boards of health to kind of collaborate and work together on, filling staffing shortages and things like that. So during COVID, before I worked here, this process had already started, and we teamed up with Tolland, Granville, Blandford, Montgomery, and Russell. And initially there was just enough funding to get, we have a public health nurse, full-time, and a part-time public health nurse. And they monitor all the epidemiology reports and do, blood pressures and things like that in all 6 of the communities. And Southwick is the lead community. So all the money for the grant comes to us, and we're in charge of all that. So we just hired Kayleen. She is the kind of the coordinator for this whole program. So for the year before she had started, I had been kind of being the Southwick health director and trying to do all the shared service coordinator responsibilities as well. So now Kayleen is our primary person for the grant. And so Kayleen and the 2 nurses are Southwick employees, but they serve all 6 of the towns.
Okay, right now, do you have any
Yeah.
questions?
Mm-mm.
Trish? Okay, so right now we're going over the proposed tobacco regulations. The town Southwick had tobacco regulations, which we adopted in 2017.
I think so.
November. And after we adopted regulations, the state came out with some. And the state regulations are more restrictive than ours. And if we were gonna have regulations, we can't be less restrictive than the state. So we're revamping our regulations to mirror the state regulations, but then also to address little minor things if they don't have signage or this or that. So that's what we're going over now, and someone from the Tobacco Coalition wrote these regulations.
From not the toilet, someone else, but there's a group called the Mass Health Officers Association, and they kind of support health departments throughout the state, and they have someone who's dedicated to they have a tobacco control program. So that's who wrote the regs. And what kind of triggered this is we haven't had any tobacco violations in a few years. We're pretty good. And we're part of the Pioneer Valley Tobacco Coalition. They are run by the Northampton Health Department, and they just do tobacco inspections. I think they have like 30 communities. So they do, I think, 1 inspection a year. They do 2 compliance checks a year. So they'll send in a minor. Well, I guess someone under 21. I don't know. I don't think you're not a minor, but someone under 21 to buy tobacco and see if they get carded. So we hadn't had anyone fail a compliance check in a few years, and we had 2 of them failed in February. And we just had another one fail this past month, which I'll talk about a little bit later in the meeting when we get there. So when they changed the smoking, there's a tobacco sales age to 21 statewide. Luckily, the state law very clearly said it supersedes local regulations. So when we had those 2 make the sales, and even this 3rd one, before we have updated our regulations, we didn't have a problem. The fees went up drastically. In addition to the age, the fees went up drastically. Most towns had a 100, 200, 300 for first, second, and third violation. And the state updated it, and we can't do less. We have no choice. It's 1,000 for the first violation.
Wow.
2,000 for the second violation, and 5,000 for the third violation. So,
5, not 3.
I believe so. I don't have it in front of me to double check, but as far as I,
It is 5.
it is 5. Okay.
Okay, so I have to.
Um, So,
Oh, no, it's all right. This is 5.
so luckily when we had those sales and we had to, and we also had to do a suspension of their permit for 3 days. And the Board of Health in February, we had a meeting. It was the Board of Health's decision to determine how long the suspension is. But so even though we were able to do it properly, obviously we want to have our regulations match up with the state regulations because people are just going to get confused. So, so that's why we've been working on this. So did you get a copy of that draft regulation in your email?
Yes, I saw that.
Perfect.
So we're on, they're not paged, but we're on
Right.
the tobacco product sales permit. And you were gonna look up what our permit is called?
Yes, I did. On our fee schedule, we just call it tobacco permit for location and sales. And in
Look it up on the.
our regulations,
Says. I have the regulations in front of it.
And the green color is what we can impact locally. The yellow comes straight from DPH. So we decided we're taking everything 1 for January 1 out, right?
Right.
yep. Yeah. I don't think we have a name for it. It's just in the section C of our existing regulation.
Go with the share drive and pull up.
I don't know if I have, this is just the computer for this room, so I can't access it.
All right, I'll have to look to see. I just wanna make sure we have the right name.
Yeah, but we're switching to the e-permitting, so we can also change the name of the permit. That wouldn't be a big deal. Cause I think we just say permit for location and sale of tobacco and nicotine delivery products. So what is the name they use in here?
Tobacco product
To-
sales permit.
That sounds a little better in my opinion. So maybe we
Sounds
wanna,
easier.
maybe we wanna stick with that and we'll just update our permit.
Write yourself a note
Yep.
somewhere.
So I thought I had that. I have like the food regs. I don't have the tobacco unless it's in a different email. I just didn't see it.
Yeah, it would have been in the email I sent on Tuesday, I think.
Tuesday, okay. Doing a search.
So if they're gonna sell tobacco, they get a permit from us and they have to get a permit from the state also.
Yeah, they need the tax permit from the state.
So that's what this is, Massachusetts Department of Revenue license.
Yep,
That's what that is.
yep,
Okay, so I guess we could keep that.
yep.
Okay, sale of business. This is something,
So actually they can just transfer their license. Their permit.
that's what that says.
Transfer of permit no later than 30 days after purchase. Purchaser shall not sell tobacco products until the transfer of the permit is approved. All
Okay.
fines and suspensions.
Do we wanna do that though? Because don't they need to have some kind of training from the state or some?
Yeah, because it sounds like we just need to eliminate A, because if we don't want. The business, the seller to if we want to make sure the purchaser. Is gonna get that A and B seem to be. Kind of contradictory, we're. They can
Right, it
transfer
says-
the
yeah.
permit, but then we're saying the purchaser. Has got to apply for the permit,
Yeah,
so. I would suggest we just take A out.
yeah. Or we could just take the whole thing out and say the permits are non-transferable. And then the new person has to,
Yeah,
All
we
right,
can,
so-
this one can be a question for, if we have someone from the coalition at our next meeting. But potentially we'll take that out. And then maybe there's a reason we're not thinking of why that's in there.
Okay, and then we would keep number C.
Oh, that's true.
Yeah,
Maybe that's a good reason to keep all of it, is because if the old person closes their business, we would never be able to get the fees out of them, and then the new person applies. So that maybe that is a good reason to keep it.
I just think it needs to be, the A needs to be clarified a little bit, or.
Yeah.
That they can transfer said permit. But then the purchaser's got to apply.
Right.
I just think that's a little,
Well, if the purchaser has to apply, then they can't transfer it,
Right. Yeah.
because what you said before, that said was contradictory. So I think if anything, we keep B. And C,
and C, yep.
and
take
maybe
that
just
out.
reword
Yeah,
B.
Okay.
Is it, you said the word, right? You said a word copy.
Yes,
Okay, so
yeah.
I can do that. Okay, retail density.
Yeah.
No,
And 500 feet of a school
no,
measured by a straight line.
no.
I mean, we could leave it in. It's kind of a moot point because there's no business area within 500 feet of the schools anyway. The
Right.
schools are all,
But
but
to
what
me-
if,
Right.
what if they sell that farmland? Is
yeah,
that 500
Yeah, I
feet?
know, but what does it matter when you have to be 21 or older
right,
and the cigarettes are behind the counter?
right,
What if you've got the same kind of issue that we have where people are selling to people that aren't 21
yeah,
without checking? Yeah.
yeah. My inclination is it's a no harm, no foul. Keep it in because there's no one, all the schools are right there and there's no business there anyway. And if that ever changes, then it's on the books, but it's not like there's a tobacco vendor
I mean, I don't think. we're
within
gonna-
500 feet now that we'd be affecting.
We're not gonna offend anybody,
Right.
but you got land, I mean, the way farmland is getting sold, I would be careful just
Right.
saying. That
Right.
would never happen here.
Yeah,
Okay. Prohibition of smoking bars. Smoking bars are prohibited in the town of Southwick. Okay, also, we have regulations. For associations where we don't allow smoking in associations, because at
Yep.
one time you could. So I wanted to put
make sure that's in here.
that in here too, just as a E or F or a G or something.
Yeah,
Um,
I'm surprised that she didn't transfer that over. I guess I'm not seeing it.
It's right here, where is it? It is. Smoking and membership associations. So Trish, all the Southwick Board of Health regulations are on the Town of Southwick website under the Board of Health.
Okay,
Michelle Hill, before she left, I think she updated everything and got everything. Which would
Okay.
be changing. So,
You wanna make that the new G?
so that maybe be the new G would be. Smoking and membership associations, we can get rid of that regulation and just say,
Put in that section.
that it's,
Okay,
that smoking is not allowed. Is that okay?
yeah,
Mhm.
Okay, oral nicotine pouches. So they can only be sold in adult-only retail tobacco stores, which we don't have any adult-only
No.
retail tobacco stores.
No, so I don't know. I don't know. That's something I would want to find out is I don't know if any of the gas stations sell those currently.
Well, because if they do, then we should take that out.
Right. If we ban it, they would have to remove them.
Yeah, so I don't want to do that.
Because those fall under the 21-year rule, right?
Yeah.
So they'd still have to be carding, yeah.
And if they want to do the nicotine pouches instead of smoking, then let them.
Mhm.
You know? So why don't we just take the whole thing out?
Yeah, we could do that if you guys wanted to.
Why don't we just take the whole thing out?
Okay.
Okay, so flavored tobacco products they can't have, period. Correct?
Yep.
Nobody can sell those.
Yep.
Okay.
And then this adding the possess, hold, and keep. So I think that is probably intended to clear up. Like I actually had this in Westfield. There was an establishment that is now a salon. Thankfully, they're not open anymore, but they had all sorts of flavored products and products that were banned by the state law. But they said they're not for sale. So I don't know if the possess, hold, and keep
Mm.
is saying they shouldn't even be in your store,
But you know what?
not just not be sold.
This makes it sound as if you can't have them in your house.
Right. That would be my concern is if,
So
if
that's
people,
not right.
if someone's walking down the street and they have them that they got,
Yeah, so,
whether they got it legally in another state or if they got it illegally, that's not something we would ever enforce.
Should we say
So,
no business or no retailer? As
Yeah.
defined herein?
well, it does say no person as defined herein, so maybe that,
just put
yeah.
retail.
Or we could just take the green possess, keep, and hold. We could just keep that out.
Okay, we'll take it
So,
out. If that's okay with everybody.
Mhm. Do we define person here somewhere?
yeah, that's good.
Yeah, person is defined as a retailer, so.
Okay.
Yeah,
Yeah, so then we can,
any retailer,
Yeah.
firm, partnership, association, blah, blah, blah.
Yeah.
Owner, operator, manager, or person in charge, so that we could.
Yeah.
We could leave that.
okay. Yeah, I think keep that in because then
Keep what in the second
keep
session.
the possess, hold, and keep in.
Because the person is a retailer, if you look at the definitions, it's not your home, it's not you in your home.
Yeah,
It's your,
it's
it's your person, you are a retailer.
right.
Okay, well, I'm gonna say no retailer.
No, it's the
It's more
definition
than
is
that.
the definition in
It's already
person.
here.
So it's already defined in the regs.
It would be like an owner operator, it would be like the salon.
Okay, wait a
Yeah.
minute, they're defining person?
Yeah, they make,
Yeah.
they got this broad,
So no person as defined herein
and that's here.
So-
in the beginning of the regulation.
So that would eliminate what a retailer, it could be the salon, salon saying she's not selling it, so she's not a
Right.
retailer.
Oh, no,
but
it's
She is a person here.
right. It wasn't it's a salon now because the tobacco
Oh.
business closed.
I was gonna
Yeah.
see if I could get my hair
Yeah.
done there. I was.
No, I'm happy it's a salon, even though I don't work there anymore. I'm happy it's now a salon and
All
not
right, so you
a,
want to keep all that. then.
yeah, I
Okay.
think keep all that because yeah, it's one of those things that, knock on wood, I don't think we have anyone that's this much of a problem in Southwick, currently at least, yet, yeah.
Yeah.
But that the specific guy that I'm referring to, they even had they went so far as to have a sign, basically soliciting donations, and they would give it to you as a gift. And so to be able to just say, no, you can't even have this in your store, that just makes it, even though everybody knows the intent of the regulation, that, no, if it's in your store, you're gonna be selling it. To just say they can't have it, I think is cleaner.
So
So,
they need, so retailers need manufacturer documentation. Do they have that stuff? Do they have that
yep,
now?
they've got that
They
now.
do that
Yep.
now? Okay. So do you have any more questions on that page?
Mm-mm.
So go to the next page. So we're gonna keep possess, hold and keep.
Yep,
Okay. Self-service display, adult-only retail tobacco stores are exempt from this section. Yeah, that's true.
yep, and we don't have any.
And vending
And we-
machines are prohibited,
We did a lot of the roll your own discussion last time.
Yep,
are prohibited.
And the
Educational.
yeah.
yeah, and that's another one that obviously the Southwick schools wouldn't do it. I think that's more intended for colleges at one point, maybe sold cigarettes, but it's another one that I don't think there's anyone that qualifies that would actually sell, but might as well put it in there.
Now, this we did, this is different than the days that you were saying to do. It's 3, 7, and 10 here. And I don't remember what we had in the
No, I
minutes
thought
for
we
what
said
we had.
three,
No, that's what we voted on.
I
Is
thought we
that
said
what-
3, 5, and 7.
I think we did
I don't
three,
recall.
I think we did 3, 7, 10.
We'd have to look
Yeah.
back in the minutes. I don't
I
recall.
did look back because I gave these numbers to Sarah McColgan who wrote this up, and I had looked back to our meeting
Okay.
to confirm.
Really? Wow.
Yeah, yeah.
You're strict.
Yeah,
Well, again, is they shouldn't be selling to minors.
Yeah.
That's their. I'm. If the first time doesn't teach them after the 3 days and I don't recall what we voted on. That's why I would say look back at the minutes. But how many times does it take to teach somebody?
Okay, so
Yeah.
those, they can't, so that's fixed.
yeah.
Okay.
I mean,
so-
I think if you really wanted to, you could change the nut because that was just kind of voted as a policy at the time. So if you wanted to put it in the regulation, obviously that would supersede what the previous vote. So you could change it, but I think keep it. I mean, we went years without having anyone, and we've had 3 this year, so I would think that I'm sure the word is out that, yep, this compliance checks are still happening. Train your staff, don't slip up because it's gonna,
Please tell me it wasn't a repeat offender.
it wasn't a repeat offender,
Okay.
thankfully.
So when it says here violations of, and they have that squiggly, I don't know what it's called, day of the. What is this squiggly D
Where is that?
under violations under?
Oh,
our-
that's section. That's the abbreviation for section.
Violations of section D.
Yeah, which
Section
would be,
Oh, that's bad.
yeah,
That's after the definitions.
That's
Yeah, that-
section D, okay.
yeah, that's like the signage and
Oh,
they need their permit and that stuff.
and that's all the stuff they shall not do. back
Yeah.
there.
Okay, and then for any other violation, these were our regulations. These are minor violations, for example,
Yeah.
signage, things like that. or
Yep,
Putting a display on the counter or whatever.
yep,
Then these were our, I think, original ones, except for a 36-month. I don't know, we have a period, but that makes sense because they only come twice a year.
right. Yep,
Now, under your policy subject to state law fines and section D of this local regulation, what is this?
so the state law fines are the 1,000, 2,000.
I know, what is this part here?
That's just outlining which policies get which fines. So if they sell to under 21, it's 1,000, 2,000. They sell flavored products, 1,000, 2,000.
Where does it say 1,000, 2,000?
And this here is in section R1 is the shows the 1,000, 2,000 and
Right,
5,000, and then section 2 is the minor violations, and that would just be 100, 200 300.
Okay, but what's this here? Policies subject to state law fines. What,
That would be, the state law fines are outlined in one. And then in policies subject to local regulation are outlined in number 2 for all violations of other sections specific to
okay,
Southwick.
so this goes with number 2.
Yeah,
And this goes with number 1.
yeah,
All right, we've seen that.
Yep, so we have a lot less in our right-hand column than.
yeah.
So then you know what I noticed, the last page is exactly like the page in front of it. What's that all about? Like, on
The
the
last
last
page
page,
of
number
it.
8, in the case of is the same as number 3 previous. I don't get it. Am I missing something? Number 9 is the same as
Don't see where you.
number 4,
Three.
and number 10 is the same as number 5. And number 11 is the same as number 6. And number 12 is the same as number 7.
Oh, yeah.
So I don't understand.
I just think it got-
That's probably just a copying error or something.
Yeah.
Yeah.
So then we go to enforcement, I guess, or.
So all those get crossed out.
Yeah, I think so.
So we keep all set, keep above that, and we take those out. Okay, non-criminal disposition,
That's,
so how are we finding these people? Because if says here monetary fine not exceeding $300 and we're having $1,000 fines.
Hmm.
And I
is
think
it might be, is it criminal?
I think I looked up the non-criminal disposition thing. Let's look it up again.
Because they don't have that defined. Oh, the caveat is that you can choose the non-criminal if the penalty calls for a fine not exceeding 300. But those 1,000 and whatever
So how would
we
you?
couldn't go back and say, okay, that when the state says you got to fine them for 1,000, this to me says you can't go back and say, well, we're not gonna fine you. You see what I'm saying? I think after that 21D is how it kind of it defines that. We can't go back to the 1,000, the 3,000 and the whatever thousand and say we're not gonna do that.
So we could use this non-criminal disposition for the minor violations.
Yeah.
But how are we finding? About,
This,
is there a letter we send out?
yeah,
or
a
what?
letter. Yeah, the state has a draft letter. And then the coalition actually kind of gives me it. So I just have to fill in the blanks and
Oh, okay, all right,
Yeah.
so it's already, all right,
yeah, so I just put in who the vendor was and when the sale was and whatever the fine is and
all right, so this is, okay.
yeah.
All right, and then separate violation each day, okay, it's violation enforcement. What does that mean? Enforcement, second paragraph, may enforce these regulations or enjoin violations thereof through any lawful process. What does enjoin mean, violations?
Not sure.
And the election of one remedy by the board shall not preclude enforcement through any other lawful means.
Maybe there's an outside agency that we can now, because the next thing says we can't preclude, we can't say we're saying something is minor, but another agency has said, okay, this is one of the biggies. And it's the same thing. Somebody from DPH, we can't preclude, we can't, say, okay, we already fixed it. Is the way I read it, but that would, maybe the tobacco person can help us with
Yeah.
that. That's a little,
So I just Googled enjoin, and the legal definition is to prohibit someone from performing a particular action by issuing an injunction. So we would be prohibiting violations.
so maybe we're telling the inspector they can't go in. We're not gonna let them inspect any of our tobacco institutions. With that we would be
Right.
enjoining.
Yeah. Okay. But yeah, that makes sense.
I think the
Does that make sense to you?
Puritans may have used the word enjoy.
Yeah.
Yeah, I don't,
I would have some let's put that
Yeah.
in simpler terms, maybe have that, maybe
I don't
have
like
the person who's kind of the expert. She can come up with a new color, it can be green, yellow, or whatever color she
Yeah.
wants to make that.
Yeah. Yeah. Shall not preclude enforcement through. Yeah. So that's
It sounds like we can't stand in the way of
Right.
somebody who has,
right.
but I would feel better if we had that.
Yeah.
okay, so I'm just going to go back to, we talked about the sale of business, E9. We're keeping B and C.
I think that's what we said.
Yeah.
We're just gonna reword B somehow, okay?
Yeah. And I'll see if I can get, like I said, I'll see if I can get clarification on that one.
All right, and then I'm
Because
just
maybe
gonna,
maybe there would be a reason to keep it all.
all right, I'm just going to, make the changes we talked about.
Okay.
This, to me, I'm not that much of a rush as I am for
The food.
Food.
Okay.
So we want the food to, I mean, it would be nice to maybe do all three at once, but,
That affects, the food affects more people.
yeah.
Yeah. And if we do, we would do the hearing for both, so it would save on. We could do one posting twice for the newspaper and everything, but if Murphy's Law, if tons of people show up for tobacco and tons of people show up for the food, that could be a long marathon meeting. So maybe it would be worth doing tobacco and food separate.
I remember the town meeting when tobacco was discussed. That was a big one.
Yeah. Okay.
We found that our hearings. No.
Yeah. People don't usually show up, but
And this food one is. Basically what they're supposed to send in anyways.
Plus the
Just now, if
choking.
they don't do it, they get a penalty.
right.
Do you have anything you want to add, Trish?
No, I'm just absorbing everything.
All right.
Okay, so,
While we're talking tobacco, do we want to listen to this one? Or you can tell us about the third?
Yeah. Yeah. I
yeah.
can do that first. So.
yes,
So that's done, that first part of the agenda, and then bog regulation renewals and fee schedule. I got nothing new to report on any of those. So now the next section is my report, and I can skip ahead to the tobacco one.
and I sent out that, the updated fee schedule that you had proposed, the $25, except for any food.
Leaving the
except
food
for,
the
I think,
same.
I added cottage, but
Yeah. So, and
you gotta see what they're.
we'll finalize that along with the e-permitting at the same time.
And this too, I'd like to put this in effect too, yeah.
Yeah, and that just has to be a vote. That doesn't have to be a
Right.
regulation.
And then for the percolation test, I went up to 175 plus $50 an hour after
Okay.
3 hours.
Okay,
But I didn't touch the repairs.
yeah, okay,
I left that the same. That's 150. That's expensive, but.
Yeah. okay. So yeah, so in my whole section of everything I've done in the last month, I'll skip ahead to the tobacco, so that's under other. So there was a sale at Saunders Package Store on, I think it was on June 19th, if I remember correctly. I got I chatted up on my phone. I didn't bring my hard copy down, but yeah, I have it right here. I got the notification, I think on the 25th or 6th. I served them their letter on the 27th. And they, the owner wasn't there, but the gentleman who was working got him on the phone, and he was, didn't fight it or anything. He came in and paid the fine today. And we both looked at our schedules, and he actually already served his suspension. So we agreed on Tuesday. So he started this Tuesday. They had all the tobacco removed from the premise. I went out and checked, and so today is their last day of their suspension. And they'll have tobacco back on the shelves tomorrow. So they did their 3-day suspension. They paid their fine. So
Good.
no hearing for that, which I appreciate, because if you sold, you sold. It's, but so like I said, hopefully the word is out. I don't know how many people actually watch our meetings, but that's 3 establishments in the past 4 months that have had $1,000 fine for selling to a minor, or someone who's under 21. And that's more than we've had in the past probably 5 years. So, and that's the first time we've had any fines since they've upped it to 1,000. So hopefully the word's out and people know, to card. So that was it for tobacco this month. So I'll go back to the top. I'll start with septic. So Trish, one of the things, I don't know how familiar you are, so I'll just try to give a little overview without taking up too much time and going into too much detail. So
Okay.
anyone that has a septic system, boards of health in Massachusetts permit the installation and the whole process of the new septic system. So the state code is called Title V, is what everyone called it. Off the top of my head, I don't remember the exact code name and number, but
1500, is it 15 or 1500 or
Yeah.
15.00?
Yeah, I don't remember. I'm gonna say it wrong. There's too many numbers in my head. But anyway, so when someone sells their house, they're required to get their septic system inspected. Those are done by private inspectors, but they send the reports to us. And then if the system fails, they have to put in a new system. So the first thing in the process is a perk test. And they dig a hole, pour some water, and that kind of determines where the septic can go, how big it needs to be. And then an engineer will draw a plan for the septic system. That has to be approved by me. And then we also do a final inspection before they bury it. And I think that's pretty much the broad overview of it. So perk tests, it feels like there's been more than this. I hope I didn't miss any, but 10 Davis Road was a repair perk. 8 North Long Yard, another repair perk. 23 Noble Steed Crossing is new construction. That is the one that I had denied the plan because the perks were invalid. So they got 1 passing perk. And in most cases you need 2 passing perks. The code does allow for the reason you need the 2 perks is where the system is actually going to go, and then a separate area, and this is only required for new construction where they call it the reserve area. So they want to make sure you can demonstrate that if you're going to build a house here, you have a place to put your septic, and then also in hopefully a long time, 20, 30, 40 years, when that system fails, you've got somewhere else to go. Because some of the, like, in the ponds, around the lakes, some of the little postage stamp lots that are still on septic, sometimes when that fails, the only option is to dig the old system up and put it back in the same place, which
So-
isn't really ideal.
So what
But
happened here? Did it not?
so they only got
Separate
one passing perk. So the code does allow for if you usually, most designs are the septic system is just one bed of stone and pipe. But you can actually do trench systems. And if the separation between the trenches is large enough, you can have your reserve area
in between?
between the trenches. So
Right.
it's a tough site. Kind of a weird, it's kind of wide. They have some wetland setbacks on one side. So I don't know if they'll be able to make it work, but the engineer was gonna try to design a trench system where the reserve could be in between. So
Wasn't that the site that they got the perks from the place?
yeah,
that
they were
weren't
they were
able to
from
do here?
20 years ago, and
yeah.
their drive, they paved over, or it wasn't paved, it was gravel. But they put in a driveway and brought in a bunch of fill. So that they got the one perk, and we'll see what they submit for the design, but it could be perfectly fine. So we'll see what they come
And
up
how
with.
fast the soils? Obviously, they're bad soils, or is there high groundwater?
It was a mix. There was one perk that kind of closer to the front of the property that wasn't moving. And then they tried some way in the back that weren't moving, and then they got kind of a spot in the middle where it was I think it ended up being a 10-minute rate.
Now,
So
are
that's
these
pretty
taking
good.
you more than 3 hours?
No, I don't think that one did.
Okay, go ahead.
Let's see.
Repairs.
So that was 23 Noble Steed, 336 North Loomis, 208 Sheep Pasture. Those were both repairs. Approved plans at 186 Mort Vining, 10 Field Street, 46 Pineywood. And then 3 lots on Tall Pine Trail that were all new construction.
Is this actually the lot number or the?
That's the address of the home.
That's gonna be the
Yeah.
address, okay.
Yeah. And then 3 Starrett Drive as well. And then final inspections at 18 Charles Johnson, 34 Fernwood, 16 Foster, 3 South Loomis, and 3 South Loomis was the one where they had to move the well. That was a big
Yeah,
to do, but they got everything done. It looked great. 80 South Long Yard. That was another kind of weird one. They had they put in the system last year, but for whatever reason, they couldn't do the tank at that time. They had a licensed installer. He was a family friend, kind of came out of retirement for them. I don't remember his name off the top of my head. So he did the system and then has had some health problems. So he never did the tank. So they had the old tank, which was undersized, connected to the new system. And they weren't trying to get away with anything. They knew, but they were finally like, I don't think he's going to be able to do it. So they got someone else to come in and put in the tank. So I've never seen an install split like that, but I haven't got all the paperwork for the sign-offs yet, but we'll just need to make sure to get the paperwork from the guy who did the leach field, the guy who did the tank, and then from Barry Searle, who designed the system. So nothing wrong there, but just it was a little unique.
Took a while.
Yeah. So and then 4 Tall Pines Trail, that was another new construction. And 3 Tammy Lane was another final inspection. Housing, that case on 80 Bungalow, I have been just the taxes there was taxes owed on that one. The taxes were paid. I drove by and it hasn't looked like much, so they're overdue. So I'm trying to I try to get in touch with Highland Valley, and they're a little hard to get in touch with at times. So I haven't been back, but I've been calling and emailing Highland Valley this week to
So
see.
what is it? Is the yard a mess? I mean, there's a lot of trash?
Yeah, it's not. I can't see the back. It was worse in the back, and you can't see that from the road. Um, so I'll see what the status is based on the deeds. It looked like it could be up for foreclosure. There was it's not up for foreclosure yet, but the initial thing they file with the registry of deeds, like that's the first step in the foreclosure process, that was on the registry of deeds. So so that was part of the reason I wanted to kind of check in with them to, if the house is going to be getting foreclosed on, kind of she'd be leaving
Yeah,
anyway,
right.
kind of weigh the options of.
So is this the same?
Yeah,
person
same
who
persons.
works?
Yeah, so so it's a tough one to kind of strike the balance of, getting compliance and making sure she has a safe place to live, as well as you don't want to suddenly kick someone out of their
That's
home.
right. You
So
don't do that at all.
so I'm trying to thread that balance, but so hopefully I'll get in there, and it wasn't terrible. I mean, it wasn't great, but
Did they clean it up?
it's
But
much
gotten
better.
back
It's
to,
it's much better than the first time I was there on the inside. Um, but yeah, so and then 32 Sawmill Park, that one I did a inspection, and Kyle, the building inspector, came with me, and the tenant had a lot of complaints, and there was a lot of it wasn't really violations, but there was a couple small violations, and I did the inspection. I haven't sent the letter yet. I'm a little overdue on sending that, so
Sawmill Park, I thought they owned.
this one is a rental. Is a rental, yeah. So I think I think initially they were condos and they were owned, but I think so since they've uh since it's not the American Inn anymore and the new owners, I think they're uh doing whatever it takes to keep those things occupied and keep money coming in. So
Good.
so that I have to send out, but it was the only thing that was actually a violation was the ceiling fan was not, like the electrical box was exposed.
That's it.
Yeah, so it was a very minor violation. So so I'll get that sent out though, because it was still a violation, so I still have to do that. So food service, Sweet Memories is a donuts. They do donuts. They did a event at Westfield River Brewing.
Through mobile.
Mobile, yeah. A lot of mobiles lately.
Yeah.
So that's something that kind of along with the fee schedule and all that, since I've been doing almost all the mobile inspections with Brian Schneider, the fire prevention officer, because they have to look at mobile trucks as well for their propane and all that. So in the past, I think that the fire department wasn't doing all of I think they did some of them, but they weren't as consistent with doing all the food truck inspections. So so Brian and we're going to talk about what's kind of the easy way to do this, because it's he doesn't really go out and do inspections on the weekends where I sometimes would previously. So we've been actually having people before their event bring the truck to town hall, and Brian and I will both do inspection of the truck.
Oh, yeah.
And there's other towns that do that. So kind of along with the e-permitting and that process, I think Brian and I will try to come up with what we think will work for us, and then I can bring that to you guys. We can vote on it, and then we'll send that out to people. And like there's been a few where I went out, and like there was one I was stuck doing some inspection, or maybe I was running late I had an appointment in the morning that took longer than I thought it was going. So he did the inspection, and then I went out for the event on the day of, because I wasn't able to go when we had initially scheduled it during the week. So I don't want to be too rigid with people, but it is kind of nice to have them come here during the week rather than have
Yeah.
to go out on weekends and everything. So, because there's been a lot more, I think not too long ago, there was like 2 mobiles and
Yeah, I remember,
I-
there were so many
yeah, I think we've done like 10 probably.
or
So,
more.
yeah,
There was just one and it was great.
yeah.
The taco one, the Who Cooks for You or
Oh,
something.
yeah.
That was at the old Nora's, what's that, the bar shop?
Yeah, it was good. Yeah.
Jim went out, of course, they had postponed the boat parade or.
Oh,
whatever,
right.
and So he was the only one out
Yeah.
there, but it was very good.
Yeah. Yeah. Who cooks for you?
Yeah,
Yeah, they were good in their inspection. So
So Pioneer Valley, is this,
that,
is this the one on College Highway?
no, that is formerly Sodom Mountain Campground.
Oh, no, you did that one last week.
Oh, then
That's-
maybe I forgot to delete it.
This last time.
I must have forgot to
You
delete
did their
that. Yeah.
store,
Yeah.
They do retail.
They do.
and
Yeah, they do some
they
food
do
service.
Okay.
All events concessions is the one,
They're mobile.
another mobile. And they might have been a temporary actually. They did an event on Father's Day at the train, Pioneer Valley, what is that called?
Pioneer
On
Valley.
Hillside.
Steamers. little
Yeah,
steamers or
yeah,
something.
yeah, the live steamers.
Steamers.
So they were
They
good.
temporary.
Yeah, they were temporary. And then the WIC, I didn't bother to list everyone out, but there's off the top of my head, I want to say it was 10 vendors. And for that, I had helped do inspections at the Big E last year. I'd helped West Springfield. And they have a 1-pager inspection form for all of their food vent because
Yes.
they've got hundreds of vendors. And so I emailed Gene over at West Springfield to get a copy of that form, and I use that for all those because even with our e-permitting software, when you're trying to do 11 inspections in a short period of time, clicking through all that, and so it was nice to just have the sheet to get the main points and have them sign it and call it a day. So that was really helpful. And then Fancy Bagels, they just opened last week. Did the inspection there.
They're making bagels right there.
Yeah, they actually had a really cool oven. That's pretty much the only thing they changed. They painted, cleaned, and did all the usual stuff, but the only thing they changed was the oven. And their oven actually, the bagels on like the racks, with the baking sheets on it that they put all the bagels on, the whole rack just wheels into the oven.
oh, wow.
And they can fit 2 racks in it, and the oven does, it steams them and it does the whole process. So
Wow.
it was pretty cool. I hadn't seen anything like that before.
Don't they supposed to like put it in boiling water or something and?
I don't
I think
know.
normally, I think if you were to make them at home, I think
New York City or
yeah,
whatever.
I think they boil them, but I think the steam kind of replaces that step, or maybe they boil them first. I don't know. I didn't.
My bagel goes in the microwave.
Yeah.
Do they do they sell anything else? I mean,
Well,
coffee?
yeah, coffee, bagel, breakfast sandwiches and things like
Oh, they
that.
do. Okay.
Yeah. So, so they were good. And
Fusion,
Fu-
Krabby Joe's.
yeah, Fusion is Krabby Joe's.
Are
And
are both places open,
both,
both
yep,
sides?
both. No, they're Fusion is gonna have the coffee side, and it was, I can't remember what it's gonna be called.
Blackboard or something. Where's
No, Blackboard Cafe is Louis B's,
Okay, sorry.
and then
Just to make sure.
Reds is Congamon
Congamon,
Coffee,
yeah.
and then maybe
No,
it was-
Red's Cafe is Little Red Riding Hood.
Mm-mm.
no, it's Congamon.
Okay,
That
no,
close. It's Little Red, right? It's
Congamon.
it's
Coffee,
Congamon
yeah.
Coffee now. She just opened.
Oh, it's not.
Yeah, it was like
Okay.
3 or 4 months ago. She
It's been
opened
in
as
front of the street.
and it was another C, like Coffee Canvas Cafe. But
Okay, so
anyway,
it's not-
at Fusion on the side that used to be the breakfast side, is now going to be a cafe. But it's not a separate permit. It's the same staff, same ownership.
The kitchen,
Same kitchen, it's just on the other side of the kitchen, so. But they were waiting for their, I think their espresso machine was on back order. So they haven't opened that side yet, but,
what did you hear about Roma?
Roma is, we met with them and they're kind of still looking at their different options. Nothing, as far as I know, nothing concrete yet. And yeah, that's it for food.
You already talked about Saunders.
We talked about Saunders. And then I finished up the pool inspection, so the Southview condos, the town beach
Has it
and
been closed? The town beach,
no,
because 4th of July it was closed.
I think they just closed for the holiday. I think,
I think they did
Yeah.
4th of July.
yeah.
But all the tests have come back.
Yep, I've done 3 tests. They were,
Do you know when it opened?
June. I can tell you if I look at the calendar. This week was the 4th test. The second
Because there's
was
an article
the
in the paper about
25th
one beaches in Massachusetts.
yeah.
That
So the first
closed.
the first test I did, I think, was on the 18th, and then they would have opened that Saturday, the 22nd of June. All of the test results, we actually have a link on our website. Now every week when I get the test results back, I put it into the state. The state has like a data portal. So I enter all the results into there. And the state has on the state website, you can look up the testing results for any public beach in the state. So we had the first week was 27 E. coli, and closure is at 235, I think is the number off the top of my head. So we're well below. Next week was 24, and then the third week was 12. And I did another test yesterday.
So how are you obtaining the samples?
I got a pair of waders.
Using-
So last year I didn't like the previous inspector for years and years had used a rowboat.
Yeah.
I wasn't a fan of the rowboat. So last year I was changing into my bathing suit. And this year I got a pair of waders.
And I think
Yeah.
Tammy was wrestling with that
Yeah,
rowboat too.
yeah. Yeah, I think Tammy would get someone from maintenance would go out with her and
Oh,
would
yeah.
help her with the rowboat.
Rowboats are easy. They should-
Yeah.
A canoe would be easier.
Yeah, and then we had a couple high tests last year too. So they were open for like a week, and then they were closed for a couple.
So you take just one water sample or you take
Yep.
a couple
Just one.
in the same place all the time?
Yep. Yeah, kind of right. I go right. You have to go out to at least a depth of 3 feet. And then you have to take the sample from 12 inches under. So I took a ruler. My waist is pretty much exactly 3 feet, and my forearm
Does your
is,
waders go up to here?
yeah, they're chest waders. So
Chest waders.
yeah, so I go out to my waist, and then my
Oh,
forearm's about a foot, so I know.
Trying to Get them off.
Yeah. Yeah.
Wow.
They're like thick, like raincoat. They're not like full rubber waders. So look, I'm only in the water for like 5 minutes, if that. But
Did you charge to the Board of Health?
yep,
Okay.
yep, the town bottom.
Yeah.
So, but I when I come out of the water, I don't know if it's just cold or if it's like feels like a little bit of damp, just a tiny bit of dampness is getting through. But I'm glad I'm not staying in the water all day, because I don't think these would do it. But for a quick trip in and out, they're perfect.
Good.
And then the Southwick Acres pool, that's the campground on College Highway. Southview Condo, I test the emergency phone that they have. And it doesn't necessarily have to be you pick up and it immediately dials 911, but that's how theirs is at Southview Condos. But I will call dispatch before and let them know I'm going to test the phone, is now a good time. so they know it's not a real emergency. And I picked up the phone, nothing. So I was like, you can't open without the phone. So they were able to get Verizon out there quickly, and I went back the next day and it was fixed. So but that's why we do the inspections, because
Good.
otherwise someone would have had an emergency and they would have found out the hard way. And then our public health, Western Hampton County Public Health District. So we did Kayleen is working on our FY24 final reporting. And we already completed our work plan for FY25. And that's Kayleen's doing an awesome job. And working with the nurses, working with the other towns. And do you have anything you want to share, Kayleen, or anything?
We're really starting with the new parent program, which that's kind of kickstarted with Trisha. She'll probably be able to talk more about that next month, but that should be up and running hopefully by next month. So that's something exciting. And then otherwise, yeah, just kind of finishing the FY24 final reporting, and that's pretty much what I got for now.
Great.
Thank you.
Thank you.
You did your work plan. All right,
Yep.
you had a meeting, Western Mass Public Health Association,
Yeah.
and the Hampton County Health Coalition.
Oh, well, Hamden County Health Coalition, there has been some news there. So for years and years, our fiduciary agent was Pioneer Valley Planning Commission. I guess over the past few years, there's been some issues there. So the coalition voted to go in a different direction. So we're currently working with the FRCOG, is the Franklin Regional Council of Governments. And FRCOG was already involved with PVPC and HCHC. So that's kind of a work in progress of kind of determining how that group's going to do things moving forward. And just for clarity, so Hampden County Health Coalition is the coalition of all of the health departments and boards of health in Hampden County, and with a primary focus on public health emergency preparedness is mostly what we talk about. So they give us support with, like, we have a emergency dispensing site plan, as if we had to do a mass vaccination or something like that. So there's a lot of state deliverables and things, and they kind of, as a group, we have hire some people to help us and make sure we're meeting all those emergency preparedness requirements. So that's undergoing some changes, but I think in the long run it'll probably be nothing too crazy. So
Okay, anything in that
Uh,
last 48
oh.
hours?
forgot my note here. So one more septic thing, and I'm glad you asked that. So these people came in today. They live at 51 North Lake, and I have the plan here. Their system's been in failure for since 2009. And they had a perk and a plan done, and
When? 2000?
in 2009, for whatever reason, they never had it installed. And then at this point, technically our perk is expired, but also it's an infiltrator system, which no one really does anymore. They've changed the sizing requirements, so they need a whole new plan. But they did request to be able to use that perk test.
2 minutes per inch.
2 minutes per inch.
Yeah.
It's beautiful sand. Tom witnessed it. So I don't see, and it's a small lot. It's pretty much 100-foot square is the lot. So they don't have a lot of space.
From 2009, they want to use the perk test?
Yep.
Yeah, but it's all sand.
Yep. Yeah. And the soil doesn't change. So, and nothing in the property has changed. Like, everything's the same on the property. So, so they wanted to be able to request to use that existing, they only had enough room to do one deep hole. But
That's repair.
yeah, it's a repair. So one deep hole and one perk.
So they're gonna have a new plan.
They're gonna have a new plan made, but they want to use this perk, which I think we have all the records for it. I would recommend to allow it.
Do you have any concerns, Trish?
None that I can think of.
All right, so you'll make the motion
I move that we accept the 2009 perk
based on Tom's
based on
recommendation.
Tom's recommendation.
I second that. All in favor?
Terry Putnam,
Sue Broski, yes.
Tricia,
Trish, yes. Okay,
All right.
so our next meeting is gonna be August 1st. And then we're also gonna have a meeting August 29th, because in September, Terry will not be available the first 2 weeks of September, and I will not be available
third week.
the second and third, third and fourth week. Third and fourth week, yeah. So I think at our August 29th meeting, we're gonna talk about what we wanna do for September meeting. Cause maybe it'll just be myself and Trish, or it would be Terry and Trish.
Yeah.
Okay,
And if we do one on the 29th, the October 3rd, so that would only be 5 weeks. So we could even skip September and just do the
well, we
end of August and the beginning of,
what's going on with the
yeah,
regulations.
it depends on the regs, so. But so we'll sort, our next meeting is August 1st.
So before we hang up, Trish, you wanna tell us a little bit about yourself?
sure. So I've lived in Southwick for quite a few years in my younger days with my parents. And then once I graduated from my profession, I moved back in 2008. So I've lived in Southwick since 2008 with my own home. So I started off as a critical care nurse, cardiac surgery, and I went back to school to become a nurse anesthetist. And then I went back to school again to get my doctorate degree. So lifelong learning over here. And that's pretty much it. I just want to get more involved in the town and see what I can do to help.
Very good.
Great.
Yeah.
Welcome. I'm glad you're part of the board now. So we have 3 members. which is
Awesome.
nice. Okay, any questions? Anybody have anything to add?
Nope.
You all set, Kayleen? All right, so make a motion to adjourn at 8:15.
And I second.
Terry seconds it. All in favor?
Terry Putnam,
Aye.
yes.
Trish, yes. Sue Broski, yes. Okay, thank you
Great.
very much.
Thank you. Have a good night.
Thank you.
Aye.